Thank you.
Thank you very much. Good to see you all.
Well, welcome to the show, Dr. Melissa Wigington. She holds a doctorate in public health and is certified. She's a certified health education specialist. She's a professor of health science at California Baptist University and teaches health communication and policy, health promotion, and disease prevention, and more. Her expertise includes promotion and education, chronic disease intervention, stress and health and physical activity, and public health. She's published over a dozen articles in scientific journals on these topics. Dr. Wigginton is active with the American Public Health Association and has participated on the Healthy San Bernardino Coalition and the Riverside County Health Coalition. Dr. Wigginton, welcome to the show.
Thank you.
So you are a professor at California Baptist University. So tell us about your journey. What led you to where you are today?
Yeah, absolutely. So I started off as an athlete very young, and I've always loved to be physically active. I was always running. My mom said I kind of went from like crawling to running. I was always super active, and I started to realize that not everybody shares that same joy when it comes to physical activity. So as I moved through to college and just trying to understand health elements and physical activity and how to make people more physically active, I started to realize that it's much more complicated than I realized. And behavior change and motivation, those types of factors tend to be huge determinants of the behaviors that we partake in. And so I just kept wanting to learn more and understand more. I got introduced to teaching when I was completing my master's degree, and I just love to share everything I've learned and really just to get people to hopefully be more healthy, to be more physically active, and to impact their lifestyles in the best way possible. So that's kind of how I got to where I am today. Lots of schooling, lots of education, but it's all kind of driven by my desire to make people as healthy as possible and give them the tools to do that.
So what sports did you participate in? Were you doing like track, or was it a team sport like volleyball or soccer? What were your favorites?
Yeah, so I ran track most of my life, but I pretty much have played every single sport. So I love all sports. I've always been super active. But yeah, track and field was where I competed.
And what were your events?
I did the long jump, triple jump, and the hurdles. So I was a jumper slash hurdler. Yes.
Wow. Yeah, those hurdles, I'm just going to be honest, are intimidating. I was a swimmer, and so there were no hurdles in the pool. So the idea of hurling myself over a hurdle is a little intimidating.
It can be at first, especially. So, but yeah, very, very competitive though.
Now, let's talk about, part of being active. There's a couple ways to look at activity. And if you're, the law of inertia, bodies in motion tend to stay in motion and bodies at rest tend to stay at rest. The idea is like, oh, I got to go to the gym, or I, got to get up and walk, or that's not for me. And then you realize when you get out there, it actually feels pretty good. And you don't have to be the star athlete to get out there and move your body.
Right. Yeah, exactly. A lot of times it's the discipline and the motivation. Honestly, it's once you do it and you're done with it, you feel amazing. So then you're like, why didn't I do this before? Or why did I hesitate? But it's just getting the motivation and being disciplined when there's so many other things that take up our time. How do we get people to want to go outside and move or move inside even, honestly, because there are, like I said, so many things that kind of consume our time.
Like watching television and playing on our phones, doom scrolling through X,
correct.
aka Twitter.
Yeah, correct. and honestly, you could do that while you're physically active. So, I mean, you could still do the things you like and just, be doing it on a walking treadmill or riding a bike, stationary. So you can still do those things, but you can still be physically active.
So let's talk about the importance of being active. And I assume, that there's no bad time to start, but if it's better if you develop these habits when you're young. So kind of talk about what happens to the heart when we are active versus when we're not active.
Sure. Yeah. So being active, to kind of address your first question, being active at any point in life is important, but obviously as children and as youth, we establish our habits very early on. And so we want to make sure that people are finding what moves them and enjoys, they enjoy doing. So, you can do any type of bodily movement. It doesn't have to be running per se, because most people do not look forward to that. So it's finding what activities they enjoy that are going to get them up and get them moving. And, like I said, if we establish these habits in childhood and in youth, they're more likely to carry them over into adults. In terms of what happens when we exercise, obviously, as you start to put stress on your body, your heart has to work a little bit harder. It has to pump the blood to get it to your muscles and to get it to the rest of your body as you're being physically active. And so that over time creates this concept of physical fitness. So the more you do it, the more fit your heart becomes. And when you're sedentary, obviously you're not really using that muscle, and your heart is a muscle. I think a lot of people forget that it's an actual muscle in your body. And so, we want to make sure that we're exercising it and using it just like we would, our biceps or, our glutes, for example.
So as I think more than half of Americans, or maybe it's close to half of Americans, are obese, and even more are overweight, or some statistics that are just mind blowing. And the just by reducing weight a little bit through activity, you can make a big difference on heart health, from what I understand. Is that correct?
Correct. Yeah. Even the slightest amount of physical activity, even a slight amount of weight loss, even it's the small improvements that over time will make the biggest impact. Again, I think so many people are kind of caught up in this, like, I have to do it all right now. I have to get healthy right now. We give ourselves these super short timelines. And I try to remind my students, when you get into this field of lifestyle modification, most people forget that it took them 10, 15, 20 years to get to this point of having overweight or obesity, or dealing with heart disease. These conditions don't happen overnight. And so they're not going to be fixed overnight, right? I mean, it's going to be small changes over time. You just have to be consistent. And it can be, any movement and any improvement in your nutrition and your lifestyle is going to be beneficial. It's better than doing nothing, right?
So let me ask you this, because on social media, for example, you have all of these quote unquote influencers. And I got to be honest with you, I hate that term, but you have these influencers who are saying, oh, you can't eat oatmeal, or others who say you have to only eat meat, and others who say, no, plant-based or you'll die. Or others will say you can't cook your food because if you do, something will happen. And it's all crazy. What do you think?
Yeah, so there's, obviously a ton of fad diets, and there's a ton of opinions on it. I think the most important advice I ever got is just to eat as little processed food as possible. So just going back to the basics, right? Your meats, your fruits, your vegetables. I usually, when I teach people about, how to shop in a grocery store, I've done that like at the community level, which was really fun. But it's, shopping around the outside of the store. Instead of going into those middle aisles where, of course, all the good food is, but
right.
Those are foods that aren't, they're not healthy for us. They're very, very processed. They have a ton of added ingredients and things that, aren't as healthy for us. And so if you kind of just go back to the basics, right? Your basics, dairy, your basics with dairy, your meats, fruits and vegetables. I mean, that's my best recommendation. I know it's probably not, people want to hear some, super research-based scientific answer, but I mean that's the best I can say, because that's what the research has pointed towards. All of these what I call fad diets, they don't last. You can't do them forever. I mean, that's the problem. So super restrictive diets, or diets that are going to be really hard to maintain, they're never going to last. And so it's about establishing habits that you can do forever.
So that is very good advice, and the best part about it is you'll save money.
Absolutely. Yeah. Oh, yeah.
So it is Heart Health Month. February is Heart Health Month. And when we think of heart disease, we generally think of people who are middle-aged or older, who are generally male, generally obese or overweight, but that's not always the case. Young people can develop heart disease too. Can you kind of talk about what it looks like in a young person, and what some signs would be to look out for?
Yeah, absolutely. So you're right. So we do typically think of older adults as being those who are at risk for heart disease, but really heart disease can impact any age group. And unfortunately, we've seen about a 2% increase each decade for within the number of young adults that are having heart attacks. So we've actually seen increases over the past, several decades in this particular population. In fact, heart disease is the leading cause, or the fourth leading cause of death, I should say, in 25 to 34-year-olds, and it's the fifth leading cause of death in 15 to 24-year-olds. So even though it's not the number one killer in those two age groups, it's in the top five. So it's still shocking. And usually, so here's the thing. So heart disease, many times we call it the silent killer because there's not always, obvious signs or symptoms, right? Until you have a heart attack or have a cardiac event. There can be some warning signs like, excess fatigue, chest pain, weakness. But of course, those things can also mirror a number of other conditions. So, just because you're experiencing, fatigue doesn't necessarily mean it's heart disease, but it is. So that makes it even a little bit more challenging, is that it is considered a silent killer because the symptoms aren't always obvious.
And so what are some of the things, and that's really scary because I know people, as I'm processing what you say, I know people who have been like, they pulled a muscle in their chest and are like, oh, I have chest pain. What does that mean? Or my arm hurts. What does that mean? And you certainly, we can't diagnose somebody over the radio that, because it's over the radio, and neither of us are cardiologists, but, it's a scary thing to think about for young people and older people.
Yeah, absolutely. And that's why, it's really important to be on top of your health. You can do self-assessments. You can go to the doctor and get, physical done where they'll check your blood pressure. They can check your lipid levels and kind of do some of those assessments to let you know your risk. But you can also do self-risk assessments as well. So looking at your family history and looking at your current weight and how active you are and the types of foods you eat. Those are usually going to be really good indicators to let you know if you're high risk or not.
Well, let's talk about lipid levels a little bit. Now, the lipids you're talking about, cholesterol, right? This is the what are artery clogging substances in the blood. Can you go into that a little bit and what that actually means?
Yeah, absolutely. So lipids are our cholesterol levels. And obviously high cholesterol levels are tied to what we call, the technical term is atherosclerosis, or kind of a buildup or a hardening of our arteries. And so over time, if you eat, unhealthy foods that increases these lipid levels, it can actually cause blockages and plaque to build up inside our arteries, which makes it harder for the oxygenated blood to get to all the parts of our body that need it. So again, it then causes, damage to those parts of the body where we can't get the oxygenated blood. So physical activity, of course, and then nutrition are two of the best preventative measures when it comes to, ensuring that we're keeping our heart health as good as we can.
So can that be reversed? If you have, maybe you've got a family history of vascular disease, can through diet, can it be reversed, the plaque buildup in the arteries?
Not reversed, but it can be prevented. So, and there are some medications, certainly outside of my my expertise, but there are some medications that can help with it. But yeah, you can't really reverse it. There's a number of different surgical measures that can be taken to reopen those arteries and to help remove some of the clogging. But yeah, prevention is the best strategy in all honesty. And that's kind of my area. I'm in prevention medicine. So we focus on trying to prevent these diseases from ever occurring. But there are a lot of really great options out there. Of course, you'd want to see a cardiologist for that.
Indeed. So just put the donut down. Just put it down. You don't need it, and have a fruit smoothie or something.
Yeah, or even just a piece of fruit.
There you go. So let's talk about the other risk, that significant risk for vascular disease, and that's diabetes. Are we seeing more diabetes in young people?
Yeah, absolutely. So again, we used to call type 1 diabetes, type 1 used to be child onset and type 2 used to be considered adult onset diabetes. And we've actually taken those terms off. So now it's just type 1 and type 2. And the reason for that is because type 2 diabetes, which again used to be adult onset, we're now seeing it in youth, in children, not even college age, but
that's
in
crazy.
Children. Yeah. And so it can happen as young as, like I said, elementary, middle, and high school. And so, it does also increase your risk for heart disease and a number of other conditions. And again, it's tied back to the same concept of healthy diet, living an active lifestyle, avoiding sedentary behaviors. And so it's all kind of intertwined in this maze of preventative medicine.
So I guess the most important thing you can do, especially as a parent, is to make sure that the foods in your house don't contribute to cardiovascular disease.
Yeah, the foods in the house. And then I would even go as far as to say, make sure your kids are active, make sure they're getting good quality sleep, that they're learning how to control and to not even control, but to address their stress levels, because those things can also have an impact on heart health. And again, we tend to think of like, oh, only older people have to worry about that. But no, not at all. I mean, like I said, even children can deal with stress, and, even children are sedentary. And so really it's all of those behaviors that need to be addressed, especially, like I said, in our youth, so we can establish those habits as we move into adulthood.
What role do screens play in that kind, because we certainly are seeing, I would say, an epidemic of mental health issues among younger and younger children. And I have to think that social media has played a role in that, or just the being captivated by a screen all of the time, because part of what human beings need is connection to one another, and you're not getting that if your nose is buried in a screen. You may be talking to somebody online, but it's different from having a warm-blooded human being standing next to you while you're doing whatever it is that you're doing. And so have you seen that plays a role?
Yeah, I mean, obviously, if you're sitting on a screen and you're, whether it's a video game or watching a movie or binge watching Netflix, you're typically not active during that time. You also tend to just snack, and you're not really paying attention to what you're eating, right? So they've said that if you eat while engaging with a screen, you tend to eat more and eat for longer than if you put the screen down and just focus on your meal. So, yeah, so we have seen some really interesting connections between our actual food consumption and screens. But obviously the big one, though, is, the fact that it leads to more sedentary behaviors. We sit for hours at a time. We can binge watch, entire seasons, but we can't find time to go, walk for 30 minutes. So, I think from that regard, it does.
Guilty. I'm guilty. Sorry.
Yeah. I mean, I think we all are, right? I think it's just a matter of moderation and finding balance. And you can binge watch a show, but maybe get up after binge watching the show and make sure you still do some activity that day, and make sure that you're eating healthy snacks while you're watching it, instead of, the popcorn and the chips, maybe.
So I'm actually surprised you said popcorn, because I thought popcorn was a whole grain, healthier food choice.
Can be, as long as you don't put the butter on it and the sugar and all the things.
No caramel?
Yeah, I mean, caramel probably, wouldn't help. So, but again, I mean, that's what it all comes down to moderation, though, truly. I mean, if you love popcorn, you can totally have it in moderation. I think that's where most people kind of tend to struggle is, you can't eat the whole bag. You can only have, a cup or a handful, so it's not completely limiting you of the things you enjoy, but just still, doing it in moderation to a way that it's not going to impact your health in the long run.
So are you currently, I mean, not exactly this moment, but are you currently teaching classes in public health at CBU, or are you busy doing research at the moment?
Yeah, so I'm a professor at CBU currently. So I teach in our graduate and undergraduate programs in health science and public health.
So how are your students, because they grew up on screens, right? I mean, that's been I imagine tail end of the millennials, beginning of Gen Z. They are to them, they are what we would call native in this technology. Do you find that they're more sedentary than when you were growing up? Do you find that they are more open to this kind of information? What are you seeing out there?
Yeah, I definitely think that they're more sedentary for sure. I know too, if you look at some of the literature, they're not sleeping as much, because when you're engaged in screens, especially in the evening time, it can actually affect your melatonin production. So it can actually keep you awake longer, which is why they recommend that you put your screens down, a couple hours before bed, so that it It doesn't impact your sleep. So I do see them being more sedentary. I do see it impacting their sleep, but I see benefits in it too. I definitely think it's a way for people to connect and to learn. I mean, there's so much information. Of course, that's the downfalls. There's so much information.
Right.
So, you can get a lot of misinformation, but I also think it's a great opportunity to learn, health information and, motivational strategies. So there can be benefits. I think it's going to come down to, moderating your amount of screen time. Like I put limits on my phone so I don't go past like 30 minutes on social media. I give myself 30 minutes a day. And then once that 30 minutes is reached, my apps will all close, they'll shut down, and they're shaded for the rest of the day. You can override it if you want to, but I try really hard not to. So I mean, you can still, like I said, I don't want to send this message, you can't do any of these things that you enjoy. It's just a matter of doing them in moderation and then still finding times for the activities that are going to help your health in the long run.
So you've mentioned sleep a couple of times. What role does sleep play in cardiovascular disease and just overall health?
Yeah, sleep is so important. I can't stress it enough, honestly. At the end of the day, the less we sleep, the more stressed we tend to get. We tend to be exhausted by simple tasks that can take much longer to complete, therefore adding more stress. And sleep is also a period of time where our bodies are able to rest and recover. And so we want to make sure that we're giving our bodies that recovery period. And I think in my opinion, it's tied more to how you're going to be able to cope and handle your day-to-day activities, right? I know for me, when I sleep well, I'm much more able to handle my day-to-day tasks with patience and grace. And, when I'm tired, it's a completely different story. I, feel rushed and I feel like I'm not getting things done but I'm so tired and it's just, so it's kind of this spiraling effect. And so, I mean, yeah, sleep is certainly important. And I don't think that we're giving enough priority to it as a society. I think that we're always willing to kind of cut our sleep short if it means that we can get other things done. But it is, like I said, it's integral to our body's period of recovery.
And from what I understand, sleep is cumulative, right? So you can't get 5 hours a night all week and then sleep for 10 hours on a Saturday and be good. You have to, you really need to be practicing positive sleep hygiene every day.
Right. Yeah, absolutely. So yeah, you can't make it up. You could take naps and things to kind of help supplement day to day, but yeah, you can't, sleep terrible all week and then make it up on the weekend. It doesn't quite work that way.
So I really think, as we're talking about heart health, and this seems, intuitive it seems like common sense, but I'm going to say it anyway, just to reinforce it. It seems like there's a whole list of things that we need to be doing for healthy living, diet, sleep, socializing with people, because certainly connections with other human beings are important to our overall sense of well-being. And then exercise, getting out and moving, whatever that looks like for you, whether it's taking a walk or playing a game or doing something, all of that then dramatically impacts the way your heart and your vascular system work.
Yeah, correct. Absolutely. And it's everything pretty much. It's our entire lifestyle. So it's, I love, people want to kind of put things in boxes, right? Okay, nutrition's here and physical activity's here and sleep is here, but they're all intertwined and they all play on one another. You have to properly fuel your body to be physically active. You have to sleep well in order to get through your day. You have to take the necessary measures to make sure that you're handling your stress. We're one of the busiest populations in the world. And I think that adds to really high levels of stress in the American population. And so just finding ways to, manage our stress and to, make sure that all aspects of our health are being addressed essentially.
So let's switch gears. I want to talk about public health careers. And, kind of if somebody were to go to CBU and want to be maybe a public health nurse or a community health worker or, something where they're, an educator, what kind of skills are they learning? What is, tell me about the field as a choice of study.
Yeah, absolutely. So as I mentioned, the field of public health is mainly designed for disease prevention, health promotion. So like I said, we kind of work behind the scenes to try to keep the population as healthy as possible so that they don't develop diseases in the long run. Our Department of Health Science, which I also teach in because I kind of teach in both, health science is designed more for pre-professional preparation. So our pre-PAs, so pre-physician assistant, pre-med, pre-dental. So I teach kind of both sides. And we still focus on prevention in both of those classes, but obviously some of them are, where I'm trying to prepare students for a career in healthcare. On the public health side, it's more towards, like I said, health promotion and disease prevention. So in those classes, students will learn obviously about all of the risk factors, the at-risk populations. We look at needs assessment. So we would go into a community and identify what needs exist and what the biggest health concerns are. And then we establish programs and interventions to address those concerns, whether it's education or maybe it's passing a policy. So then we would come up with a intervention or solution. And then of course, a big part of what we do is we want to make sure it's working. So whatever intervention or policy or program that we create, we then want to go back and make sure that it's, providing the results that we wanted to see. And so then we go back and evaluate the success of it. So that's kind of the public health side. And then, of course, like I said, on the health science side, it's really about preparing future healthcare practitioners for their careers in medicine or as a physician assistant. And so we work with, again, understanding health promotion, disease prevention, but also how to be a good health communicator, understanding how disease develops in the body. So some of those basic, kind of introductory concepts that they'll build upon in their respective graduate study programs.
So it sounds fascinating. And the public health, I find absolutely fascinating because you have to engage. It's not just that you're going to, okay, public, this is what you're going to do, because everybody does that and it doesn't work. But in order for it to be effective, you're really talking about engaging culture, engaging grassroots, engaging all of the systems that already exist in a community to work with them to find a solution that they can then own and apply to their own lives. Is that correct?
Yeah, absolutely. So almost every single class, we talk about the impact of culture and a person's belief system, how they were raised, how they view health and how they define health, because every person defines it differently. Some people will go, oh, well, I have no disease, so I'm healthy. And I usually remind my students, I know plenty of people without disease, and I would definitely not say they are healthy. So it's more than just, if you have a clinical disease or not. It's about your social well-being, your mental well-being, your spiritual well-being, and of course the physical aspect as well. So are you physically healthy and do you feel well? So, and like I said, all of those things are impacted by our culture and how we were raised and the experiences that we have. I mean, all of those things impact our health and how we view it.
It's interesting because, health is, to me, our culture as a United States overall tends to be, well, if you're skinny, you're healthy. And if you're overweight, you're not. And then you have on the far extreme, that you're healthy at any size, which is absurd. But that to say that you can't be unhealthy and skinny is equally absurd. So it's really diving into the entire being and doing all of the things that create health and well-being in your body.
Yeah, absolutely. And yeah, that's why I said, I mean, it technically, so I know a lot of times we use BMI as like our measure of overweight and obesity, and it's not the best measure because it doesn't really account for growth spurts. So it's not good to use for children. It doesn't really account for muscle mass. We don't really like to use it with people who are very, very active or, build a lot of muscle. But I always kind of use it as an example in my class because I'm, 5'8" and probably 160 pounds. I'm classified technically as overweight, but I'm probably the healthiest I've been in my entire life. I just have a very fit, muscular shape. And so, that's where, again, it's not always coming down to how you're classified based on your height and weight. And I think that sometimes people get so wrapped up in that. And so, like I said, and it can go to either end of it, as you were saying, and kind of how I mentioned initially. I know plenty of people who are thin and don't have any physical signs or symptoms, but I would still not say that they're healthy based on the foods they put in their body, how physically active they are, just their overall well-being. And so, it does go farther than just what's my BMI and do I have any specific signs or symptoms. You have to look at the overall concept of well-being, and it's so much more significant than just your weight based on your BMI, for example.
Indeed. So we are about out of time. Melissa, tell people how they can find and follow you, learn more about studying public health at California Baptist University, and otherwise engage with you.
Yeah, absolutely. So you can always go to this Cal Baptist webpage and you can search under faculty and you'll find me there. Or you can go under our College of Health Science and look at the faculty list, and you'll also be able to find me there. So, and of course, my email is listed as well as my office line. So I'm always open to answer any questions or help people in any way that I can to find what's going to motivate them and get them to live a healthier lifestyle.
Well, Dr. Melissa Wigginton, thank you so much for your information about being heart healthy in this Heart Month and just being overall well-being, and for joining us today. Thank you so much.
Yes, thank you for having me.
KCA